We titled today's talk as how to deal with that during COVID-19 pandemic. And as Dr. Sanjeeva Rajapaksa timely said, it is it's a very important part. We are having issues, so we want all of your help to solve the issues that we are facing at the hospital too. And when it comes to COVID-19 pandemic, I think I don't have to tell you that it has brought many changes to our lives, from the very small person to a person with money, because this unknown disease was costing the lives of the loved ones. And no country has been spared, and we are these days facing the brunt. And I think you will understand. So I want to start this with our annual statistics. And I have looked into the statistics, and you can see in 2018 to 2021, and usually the JMO's office for a year, we handle about a total of 1,100 to 1,200 postmortems per year. And out of that, 25% is handled by the Department of Forensic Medicine of the Faculty of Medicine, where we work Monday, Tuesday, and every other weekend. So you can see here, in 2018, we have handled over about 1,279, and with little bit fluctuations. And then next year, only an increase of 200. As you know, COVID started in 2019. Again, quite similar, but small fluctuations. And the 2020 also continued the same, extra to around 200 deaths than the usual. And you can see what is happening this year. Now, the increase started in December, and then we are handling for a month around 150 to 60, and then with little bit dips, and suddenly last month it shooted up to, we have handled 447 inquests in the JMO's office. And you can see we have been handling more than the twice the normal amount. And as you know, the criminal investigation is happening, so nobody in the system cannot be spared when such a thing happens. So our main today, this learning session also, as a part of the solution to the problem, what we did was we really analyzed, myself and our registrar, we analyzed the last 2 weeks deaths, especially the inquest, what we have done at the JMO's office. So from 14 to 28, for those 2 weeks, the total number of deaths that has been reported to North Colombo Teaching Hospital, 304, and total number of inquests, out of that, we have done at the handled from the JMO's office 76%. Out of that inquested postmortem, somewhere around 72% were COVID-related deaths. Now you can see, with limited staff, limited facilities, the refrigerations are not working, and then things were going out of control and system collapsing, you can see. And when we analyze the total number of inquests of COVID-19 related deaths from wards, it was 20 or 9%. And what we felt, we analyzed in detail, we felt more than 50% of these deaths could have been avoided. So inquest could have been avoided. That means, in other words, cause of death could have been given from the wards. So let's start with our basics. So what we felt with the analysis, I'll tell you further what has happened. We felt that the basic parts, a refresh is needed. So I will start with that. when it comes to the declaration of death, as the basic part you have to understand, and it's an official announcement of a person's death, which you do according to the country's law, mainly under the birth and death registration, and done by these declarations are done only by a reliable and a responsible person. So only medical people or a civil servant can do this. And why it is important to a country, as I said, this is a legal need where the Register General Office issues the death certification based on the death declaration given by the medical officers. In other words, from the house officers to the consultants who are handling the cases will be putting their signatures and their responsibilities to this document. And this death, when it comes to death certificate, is really important to the family members and their dependent, because it is the legal documents for from the property issues, as well as compensation, or even to claim their pension and so forth. So not only the legal document, because it has the cause of death, then the more investigation. For instance, if we say the cause of death is TB, then the the family can be screened for it. So therefore, there is a social part as well as personal part. And when it comes to Register General using information, these death certificates, because these are the main sources which goes to the country's mortality statistics. So these statistics are the statistics we compare across the countries. That's why you have to write it according to a format, and we will be talking about the WHO format in the due course, and to enable to compare across many countries, but also to establish national program priorities, because based on these statistics, especially the mortality statistics, then the priorities, which diseases is getting priority. So your whole money allocation also depends on. So you can, I hope you understand, when you put a death declaration, there is a big picture over there which you are contributing. So let's move. And the other part, which I have to say, issuing a false certificate, death certificate, which is based on the declaration of the death. If you issue it, it's a criminal offense, and a doctor should never be part of it, and you will be facing criminal charges. So when can a doctor declare a cause of death? Now, death declaration, as you know, depend on the circumstance as well as the cause of death. And when the circumstance of death is unnatural, that is, whether it's a suicide, homicide, or accident, or even undetermined circumstance where there are a lot of suspicions, then or where the cause of death is not known, definitely you have to make it to undergo an inquest by the legal authority, that is the inquiry into sudden death and the magistrate of the country. But rest of the instance where if the death is natural, if it happens in a healthcare institution, whether it's private or state health, if the criterion are fulfilled, then you do it with the death declaration form, which we call B33 form. And if the death happens in a community, at a home or any other private place, then certificate of cause of death, which we call B12, is used. And if you look at the real practical scenario, most of the instances, the GPs who go and at home deaths, we may certify the death, the B12 form is hardly seen to be used, but many of them write in a piece of paper with their official letterhead or their seal, stating that they have attended to the final, certified the death as well as the probable cause of death. So, so let's move to the inquest part. As you know, the laws regarding inquest in Sri Lanka is stated in Chapter 30 of the Code of Criminal Procedure Act number 15 of 1979. As I stated earlier, if it is unnatural, suicide, homicide, accident, even if you know the cause of death, still it has to undergo a mandatory inquest. And if such death is happening in the wards, the doctor's duty is to inform the police post. So you have to put a record in the BHD. Now, when we analyze BH, I think I will state that fact here. It was some of the, over the years, we have seen the deterioration of the recording in the BHD. The date, times are not there. So this is a legal document, and if something goes wrong, this is the document that produced to the courts, and all of us are going to highlighted in a very bad way. So I take this opportunity and urge especially the house officers and the middle grade people, if you make an entry, put the date and the time and proper entries which is readable. Please do that. So you have to inform the police, you make it a record, and also you have to inform the director, because they are the people responsible to get the necessary legal officer, that is either the ISD or the magistrate involved in the case. And if the cause of death or probable cause of death is known, you have to record it in the BHD, and in such an instance, you don't issue the death declaration or B33 form. So as I promised you, I will come into the analysis, the 2 weeks analysis and what we found. As you all know, this notion that a death within 24 hours of admission to the hospital should undergo mandatory inquest is coming from generation to generation. This is actually an incorrect notion. For if I tell it in Sinhala, ayya sanskrutiyen eka ayya keneකුගෙන් ඊළඟට මල්ලිට එන සංස්කෘතිය. So what is the real answer to that? You don't need to do, you don't have to do this. It's not a mandatory inquest. And when we analyzed our 2 weeks, the deaths, inquest deaths which has come from wards, you can see the typical scenario with a positive RAT or PCR. Then why the main reason we feel it is this notion of believing that you, even though they have written the cause of death 24 hours, that you believe it has to undergo, and it is not so. If you know the cause of death, if the criteria are fulfilled, then you can go for a declaration of death, and since this is a natural illness. So I'm again saying this is same as the blind leading blind. So I sincerely hope with this education today, we will be seeing a reduction of this part of thing. So get it out of your head that there is no such legal requirement that death within 24 hours is a mandatory inquest. But you have to be, again, be very careful where this death occurs. If it was a death which has come to the OPD, then the criteria are not fulfilled, because you may the body may be brought dead or maybe in the gasping kind of a state. Then the treating part is no more there. I will further describe in the latest slide. When it comes to the death that the need to undergo inquest in a ward setting, if it involves any prisoner or any person in any sort of custody, from police to even like child caring center, then mental health institution, leprosy hospital, it has to undergo a mandatory inquest, and these are mainly magisterial inquiry. Again, your duty to inform police and inform the director. And I think I would now allow Professor Kutulwatte to start from here to talk about the surgical and the post-surgical deaths. Indira, over to you. And here I think I have to apologize. Dr. Handun Wijewardene is at the maternal death review meeting, and he will be joining us later. Indira?
Okay, so almost all surgical and post-surgical deaths need to undergo an inquest, a mandatory inquest, especially the ones related to trauma, and there are any issues related to medical negligence. They allege that there is issues of blood transfusion, post-surgical infections, or any other reasons. So anyway, there can be issues of medical negligence, even if it is unavoidable death. So therefore, it needs to undergo a mandatory inquest. Even maternal deaths, when it comes to maternal deaths, all maternal deaths, irrespective of the circumstances, whether it is natural, suicidal, or homicidal, or accidental, whatever it is, it needs to undergo mandatory inquest, not only inquest, followed by post-mortem examination. All the coroners have been advised to refer all the maternal deaths for post-mortem examination without releasing at the inquest, as the doctors, medical officers treating maternal deaths, even though it appears as the cause of death is very obvious, it appears that this was due to that, it is a requirement, because it is not to find fault of anybody, or not because the circumstances are suspicious, just for our improvement of maternal mortality. At present, the Sri Lanka is having only 2-digit number per year of maternal mortality. So we want to improve further, right? So for that, we need to know why these mothers have died. We need to know the reasons and underlying factors. So then they need to undergo a mandatory autopsy. But actually, ideally speaking, it should be a pathological autopsy, where with the consent of the patient, or the relatives, we can do the autopsy. But this pathological autopsy wouldn't happen because of a lot of practical reasons. As a result, the ministry had issued a circular through the Ministry of Justice that every maternal death should undergo mandatory inquest followed by post-mortem examination, not for judicial reasons, but for the health reasons.
Yeah, and to add what Prof. Indira has said, this circular, what you see here up, was issued in 2015. So over the years, up to so far, we have been doing medical legal postmortems. Each death, medical legal postmortem has been conducted, and as you know, with the COVID, the maternal deaths also this year, they think it will go up. The 2-digit part we may not be able to manage. That's what the forecast from the Family Health Bureau. So let's move to deaths in medical and the pediatric wards. And as you know, they are, most of the instances, they are the natural illness and natural circumstances. And all natural circumstances, since it is natural circumstance, and many of these deaths where the cause of death or the probable cause of death can be given, the death declaration form need to undergo. But however, if there are issues, even though you know the cause of death or the probable cause of death, but if you have issues related to identification, for instance, we say a destitute, you don't know the name and the whereabouts, and there are no relatives there, and then finally the death disposal part will be done, has to be handled by the government or the hospital sources. Then that sort of an death, a mandatory inquest, you have to go. And then competing medical conditions where the cause of death and the probable cause of death cannot be given, and you need to find out why the patient died. Then medical. Indira, can you give with an explanation here a little bit about this kind of a competing cause of death,
Yeah.
Indira?
Yeah. So there can be instances where the treating physician is not sure what is the real cause of death, because there are two competing causes of death that could attribute to the cause this death, right? So both are natural. Maybe a person who is having dengue hemorrhagic fever and treated for dengue hemorrhagic fever. On top of that, he is also now it is recovering from dengue, and but on top of it another infection that occurs and that had caused death, or if the patient is having acute myocardial infarction on top of the infection. So what actually caused death is if the treating physicians are in a dilemma, they can request for pathological postmortem to find out what actually had caused the death. It is not necessary to go for an inquest or judicial postmortem. That actually should be a pathological postmortem examination. And also, there are some instances where it can be totally appeared as seemingly a natural cause of death, appears as a natural cause of death, like a bronchopneumonia. But that bronchopneumonia is in a man who is bedridden for 4 years, but he is a young man bedridden for 4 years as a result of an accident where he has become quadriplegic following cervical spinal cord trauma. And on and off hospital admissions, being nursed at home, you are sure that the man died of a natural condition now, but that natural condition is not the underlying cause of death. Actually, bronchopneumonia is due to prolonged bedridden of this man, which had caused due to the road traffic accident or whatever the trauma he had faced 4 years ago. So there we have seen instances where board is releasing such deaths with the declaration of death form and ignoring the initial accident or initial trauma which had caused death. So please be careful in such instance. A person who has died of a bronchopneumonia or some other natural pathology, but the initiating factor is some trauma, mandatory inquest needs to be there. Okay.
Right. So let's move to the criterion to be fulfilled prior to death declaration. That is in healthcare institution, and this is the B33 form, and you will only fill this if the cause of death is known and the cause of death is natural. And And these are the criteria. Now, why I said in the OPD, the deaths which are coming to the OPD or within soon after coming to the OPD, if it is dead, then these criteria are not fulfilled. Now, the doctor is the attending physician. So of the last illness of the disease, including the doctor who confirms the death. So in a ward setting, you can definitely, even though it is within 24 hours, you can definitely see you are fulfilling the criteria. And then the doctor has treated the disease recently, and the doctor has viewed the body. So if these three criteria, Indira, can you also tell a little bit further explanation? Now, as you know, the newer technology,
now here actually at present, even though it is coming routinely that the body should be kept for 2 hours after death, to be sent to the mortuary in an ICU setup. Now we can ignore that because we have all monitors, and if the monitor shows that it is an asystole, we can do it. Because those days we had to keep the body for 2 hours because we are monitoring these patients and we are diagnosing death by our manual methods, pulse rate, heartbeat, and the pupillary reactions, and those can be sometimes, there can be errors. But with modern methods, the monitors, we can send the body before 2 hours in the newest hospitals or ICU setup. So similarly, with at OPD, we may be able to easily diagnose with available facilities a patient who is coming with chest pain to do an ECG is an easy thing at OPD setup. Now it is done. So ECG available evidence is there. Even within few minutes a death had occurred, we can issue the declaration of death form because we have the cause of death, that there is no such suspicion. In such is that is.
So you can see now over the time, definitely we have to change the some of the notions that we believe are changing. And as you know, the death declaration, as I said earlier, we have to do it to a system where it is comparable. So the recommended way of recording cause of death is the WHO format, and the typical WHO format is stated here. Now, for instance, in this case, the immediate one. So you have the immediate cause and the antecedent causes. So which is due to, so each one is due to, you can even go up to D or E based on the scenario. So these days, the Ministry of Health, there is another project going about the quality of the cause of death they are analyzing, and they have identified issues also. So especially the time frames of the illnesses are not putting, and they are very keen. So wherever possible, definitely, if you can put, you are advised to put the time frames also. And when it comes to cause of death, I think I have to again, Indira, we have to tell a little bit about the type of the mechanisms of death. Indira, can you little bit highlight on that?
Oh, yes. Now, we have seen most of you giving the cause of death as cardiorespiratory arrest. Every one of us finally die of cardiorespiratory arrest. So cardiorespiratory arrest is not a cause of death. Actually, that is the final mechanism. We don't need to include that mechanism of death. Actually, what led to that cardiorespiratory arrest is the one we should mention. According to the ICD-10 classification, some recognized cause of death should be there. It should never be cardiorespiratory arrest. It should never be something like heart failure, right? What? Congestive cardiac failure, whether it is left ventricular failure, that can be included in the cause of death. But what are the underlying factors for this left ventricular failure also need to be written. Finally, the statistics of the Ministry of Health will be taking the last factor you have mentioned, cardiorespiratory arrest. If you have mentioned only cardiorespiratory arrest, no clue to anybody, then all the deaths are due to cardiorespiratory arrest, nothing, no clue. But the statistics wise, we take, if you have given cardiorespiratory arrest, we will be ignoring that. The most important thing is the underlying factor. What led to this cardiorespiratory arrest? So if it is organophosphate poisoning, they due to respiratory failure, due to organophosphate poisoning. So organophosphate poisoning is the cause of death. Like that, always there should be some accepted, ICD-10 accepted classification, cause of death, rather than giving a mechanism of death.
Yes. Right. Now we will move into the COVID deaths. As you know, ministry has time to time issued guidelines as well as circulars regarding the death as well as the death management part. And this circular has been issued in somewhere in June this year. And according to that circular, they divide the deaths of COVID deaths as death due to PCR or RAT positive into 3 groups. One is death due to COVID-19 infection. The other one is death contributed or associated with COVID-19 infection. And the final one as death where PCR or RAT positive as an incidental finding. Now, for instance, if I say a person was found hanging, and then when you do the screening part, we found RAT positive. So definitely, you know, the cause of death is ligature suspension, and it's an incidental finding. So Indira, can you give us give another elaborative explanation of that type of a nature, an incidental finding?
Yeah, so you may find the COVID-19 as an incidental finding in a case of a traffic accident, in a case of hanging, in a case of suicidal poisoning, as well as in a case of a natural death, a liver failure, in a hematemesis following cirrhosis. So the body will be sent to us, or at the OPD you may find that it is RAT positive. So it can be due to anything, the cause of death, but COVID-19 has no contribution at all, but it is something incidental. But
yes,
because of our statistics, purposes of statistics, you need to mention that it is COVID-19 positive, because finally COVID-19 statistics will be taken, but it is not a COVID-19 causing death. So
yes, so when you write it as an incidental finding under 2, the contributory factors, then you have to put it within brackets, the incidental finding as RAT or PCR positive. And here it is very clear, they are very clear in the circular. It is not mandatory for clinician to refer all deaths in COVID-19 positive in ward patients for an inquest. Now, can you see what is happening? If the cause of death is natural and clearly known, and if the patient has died in hospital or healthcare institution, the death declaration form, stroke death declaration, declaration of death form or B33 form has to be filled by the consultant stroke medical officer. So here, as you all know, most of the instances, it is the house officers who would be writing, but under the supervision. So definitely all of from the consultant above, everybody become responsible for this document. Who treated the patient? Now you can clearly see if they have come to the ward, definitely you are coming under this category. Who treated the patient and notified, unless it warrants an inquest according with the Code of Criminal Procedure in Sri Lanka. Now, I think we have cleared that part, and where if the circumstance seems to be accident, suicide, homicide, or even undetermined, where there are so many suspicion about the circumstance, definitely then it has to go for an inquest. But otherwise, if it is a natural one, then you have to you can go for a declaration of death. And it is advised to write the place and the mode of disposal also in the same form. Indira, do you want to add any further?
Yeah, because this place of disposal need to be added, especially at present. It may be changed soon, but at present, the COVID positive deaths, we need to go for cremation unless there are religious reasons and the relatives want it for burial. Then it should be specially arranged and sent to special areas which are recognized in Sri Lanka. So because of those reasons, we need to mention this COVID-19 part, and you need to mention how the way of disposal in your declaration of death form. As after that, the necessary arrangements can be done.
And as you all know, in Ragama, this part, the disposal part, there is a designated MO who is helping us. I think if I remember his name, it's Dr. Asanga, I think. And there is another, in the director's office, they are doing a marvelous job coordinating everything. And presently we are, I think, handling it in a better shape. As I thought, it's nice, it's to make you all understand more clearly. This is, I'm not going to put any label on anybody. This is an example what we thought it was an unnecessary inquest death due to COVID-19 infection. Now, for instance, this lady, 64-year-old female with diabetes, hypertension, dyslipidemia, typical clinical scenario, fever, cough, SOB 1 week, and rat positive on admission, dyspnea, tachycardia, and 62% of oxygen saturation on air, and she was on oxygen, but she died within short time, within 12 hours of admission, and clinically and the investigation, the probable cause of death was ascertained, and correctly they have put it in the BHC also, probable cause of death as COVID-19 pneumonia, and it was sent for us for inquest. So what we did, we also did, as you know, when it comes to COVID-19 deaths, as much as possible, of course we do, if it is a mandatory inquest, if it's involved trauma, with all the PPE, everything, we do COVID-19 deaths. But if it is natural, most of the instance, when there's large number, most of the instance we talk and do a verbal autopsy and then give the cause of death. So our cause of death was also as one COVID-19 pneumonia, and under 2 contributory causes, diabetes, hypertension, and dyslipidemia. So you can see, in a typical scenario of this nature, you have done everything you can do in the ward. What is the need of this inquest? So,
yeah. And also, don't expect coroners to review all your BHT findings and everything and come to a conclusion regarding cause of death without referring it to us. Even if you have not given a probable cause of death, even if you have given a probable cause of death, why you have not issued the declaration of death form in this COVID body is an issue to the coroner. So he will definitely put it for or mandatory autopsy by us. So which is an unwanted thing in a patient you have treated for COVID-19 pneumonia. Coroners are non-scientific people. They are political appointments. They are not educated in science. They can't evaluate your BHTs and your treatment for histories and your findings. Therefore, don't expect them to analyze everything and come to a conclusion regarding the cause of death by giving a probable cause of death. If you have given probable cause of death, that means he will think that there are some issues, either identification issues of circumstances not known or something like that. They will
or even negligence, isn't it?
Such issues, negligence. If such issues are not there, please give the declaration of death form without putting it for an inquest.
Yeah, and Indira, I think it's nice if you continue with this slide as well.
Right. So COVID-19 can cause death not only by pneumonia. The one thing is pneumonia. It can cause death due to ARDS, and also COVID-19 leading to sepsis and then multi-organ failure finally. And maybe COVID-19 positive person, that is those two actually, ARDS and COVID-19 pneumonia and leading to sepsis, those are actually directly related to COVID-19, but there can be other natural conditions or other medical surgery, as we have already said, medical or surgical conditions leading to death, but incidentally or maybe a little contribution from COVID-19, then it comes as number 2. Then, in addition to that, now we know the COVID-19 can cause death by increased coagulation tendency, where the patient might die of heart attack or ischemic heart disease or acute myocardial infarction. That is due to occlusive thrombosis of the coronary arteries due to the increased coagulation tendency of this COVID-19 infection. Then, actually, that is already described and it is published in our new scientific literature. But at autopsy, we may find not only the coronary arteries, there is this coagulation tendency everywhere in the body, even in the other organs, you will see that coagulation tendency. So that could be something we have to keep in our mind. Even it may come as myocardial infarction, but underlying reason may be COVID-19 infection because of the coagulation tendency.
Yeah, so this is that area I think you have to be very, very careful when you put the cause of death, whether COVID-19 infection for the both, as Prof. Indira has explained, where it's a part of the other illness plus COVID or other illness, and for instance, coronary artery disease, no blocking with the thrombi, but whether it is only coming under 2 as a contributory or other illnesses in the as a incidental find. So these 3 areas, be very careful and think carefully and then formulate the cause of death. So you may need assistance from the clinicians and come to real proper form of forming the cause of death, isn't it, Indira? Just rather than only we advise the house officers or registrars to analyze it very carefully and come to final decision about the where you are placing the COVID-19 infection.
Yeah, so we are available. If you don't have any issues, you can anytime call us. We are having 24-hour on-call roster. Even in the night, when you want to release your disease, you can contact us and talk to us if you have any issues regarding how to write the declaration of death form, or whether you want to go for an inquest, you need clarifications with us. Is this body needs inquest or not? So for that, we are available at any time.
And we offer you, and there is an on-call roster. Mondays and Tuesdays, the Department of Forensic Medicine is on call, so the consultant is on call, and the rest of the day, Dr. Handun Wijewardene is on call, and you can call any of us and then and clarify any doubts which you are having, whether you need to go for an inquest or whether you can give a cause of death in this instance. So I would, these are my our final slides, and what happens when unnecessary inquests are ordered for COVID-19 deaths. And most of the instances, you know, when a death occurs, a COVID-19 positive person dies in the family, most of the instances, the family members are also infected with COVID, and they need to be in a quarantine. And the issue is, for an inquest, at least minimum of 2 relatives must come who knows about the illness and to give information. And so most of the time, it's the COVID positive people will be coming to the hospital and for these legal procedures. And not only the hospital, they need to go to the police stations in that particular area and bring police officers. So they need to go and talk to the ISD. They have to contact with people, and then the registration. Doctors need to take the history, and most of the instances, then the delay of the disposal. So you can see just one single error from one end will cause a big issue to the society, and our main aim here is to if we can limit this number, that's our main aim. Indira, can you add a little bit more?
Yeah, so here now, I think in conclusion, we can say that we have to separate. There are 3 types, right? So one is where you can definitely issue the cause of death, even though it is COVID-19, because you have treated for COVID-19, you know the cause of death is COVID-19, you can issue the declaration of death form, even though you are not quite sure about the real mechanism of death, whether it is a COVID-19 related pneumonia, whether it is ARDS, maybe you are not quite sure about that, or multi-organ failure, you are not quite sure about that, but you know it was a full-blown COVID-19, he deteriorated and died. So if you want some clarifications regarding the exact mechanism of death for further treatment purposes, further the new medicine development things, of course, you can talk to us and get all the samples necessary, but it is not mandatory inquest, definitely. But if there is any other issues in the case, maybe alleged medical negligence, maybe any other, we have mentioned the mandatory inquest, these cases to go for mandatory inquest. So present death or something like that, even though it is full-blown COVID-19 infection, you know the cause of death, it should go for an inquest. And on the other hand, incidental COVID-19 positive, and you know the cause of death, it's due to cirrhosis of the liver, portal hypertension due to cirrhosis of the liver, you can issue the cause of death, and as an incidental finding, you can document that the patient was positive for COVID-19. And on the other hand, if it is an incidental finding and the death is due to something else which is related to, which is a condition which needing inquest, as we have mentioned before, again it should come to us. So we have to keep in mind about those things. I think when you are issuing the cause of death or requesting inquest.
Right. So I'll then conclude the session. We are reaching, I think, closer to 1 o'clock also. And with this quotation from Peter Drucker, the greatest danger in times of turbulence is not the turbulence. It is to act with yesterday's logic. So the yesterday's logic, I hope this 24-hour notion that it has to go for mandatory inquest will be out of this logic. So please, we urge you from the even though Dr. Handun Wijewardene cannot come because he is in the maternal death mortality meeting. Handun, Ane, at least you are there. And can you, Handun, tell a little bit?
Anyway, I am sorry, I just finished that maternal model review. Okay, you can proceed. You can conclude. Anuruddhi.
Yes, and so as from our end, Dr. Handun Wijewardene also available at any time, as we said, to contact if you are having any doubts. So we will, with this, I thank you, and then Handun, I think there are a few questions. Will you?
Yes,
I think with since Handun is also there, we can answer more. Somebody is saying, Madam, after requesting the inquest where cause of death is unable to give an informing director of the hospital and police post as a house officer, thereafter how we should proceed? Handun?
Yeah, can you repeat?
After requesting the inquest where cause of death is unable to give, informing the director and the hospital post as a house officer, thereafter how should proceed? So it's like tagging and body bag and that sort of a thing, I think.
Cause of death cannot be given.
Yeah.
Then they have to order an inquest.
Yeah, so they have requested an inquest. They don't know what to do after that.
Right on the BHT. Ask the director that this death has happened and request him to order an to authorize to hold an inquest. To authorize, we should get the authorization from the director. Then write to the police to make arrangements to hold the inquest. Only that two parts are enough. No need to write to the JMO, even no need to write to the coroner. So just inform the police and get the authorization by the director. Then the police will come with the relatives and they will proceed with the inquest. Only that, only two parts there. Parts are there, only.
And then of course the what to do with the body, that as a duty of the house officer, it's your
now he is responsible for the dead body. Now till he send the dead body to the mortuary. So that part is taken up by the sister or any other nursing officer. But doctor is responsible. They have to be sure that properly the dead body was handed over to the mortuary. Only that.
And the necessary labels, isn't it, Handun? That the correct labeling has to come in with the deceased body. That's very, very important. And can you, Handun, further elaborate what we are facing these days?
No, now the nurses now they know, they have been instructed what to write there. In the ward deaths, they have to write the name of the deceased, age, ward, BHT number. These things are very, very important. And ward number, BHT number, date of death, these are important. So you have to include the sheet. That label should be attached to the dead body. And if you cover the dead body with polythene sheet, nowadays we are putting into the body bags now. On the body bags also they have to put that label, similar label in the pocket in the body bag.
Yeah. There's another question, Handun. What is the probable technical term to use to indicate in the immediate cause of death of a person who died at home due to old age, even though the person has other comorbidities? Handun.
Now, probable cause of death. Now you can't give if you have not treated the patient earlier. If you know the disease condition, only you can give the cause of death. Just by going to the home place and giving the cause of death is not reliable, and you cannot give like that because you don't know. By asking the history, they may say that the chest pain occurred, the sweating was there. You may be misguided by the relatives after killing the person. Although you know the cause of death, you can give the probable cause and order an inquest. The coroner or the Grama Niladhari will resolve the other problems, and they will accept your cause of death if they are satisfied.
Yes. There's another question, madam. Do you have to fill 1C on WHO form all the time in every patient? The answer is no. If your cause of death is only 2.
Yeah, at home let's they issue DC. Don't issue DC there. You cannot issue. You don't have.
No. They are asking C 1A, 1B, 1C. All the time C may not be there.
Yeah.
So you may write the cause of death even only maybe as 1A and sometimes 1B. It's not really necessary. Handun, explain a little bit more.
No. If the doctor knows the disease condition of the person, they can write according to the WHO system.
Yeah, all the time you don't need to fill A, B, the C and D, because the cascade of events, if the cascade of events falls, is stopped with 1A and 1B, it is definitely okay.
Okay, now he may give cause of death as bronchopneumonia.
Yeah.
Then he knows that this patient was suffering from long-term suffering from this pulmonary TB.
COVID-19 positive, we need to dispose the body as COVID-19 body.
Yes.
Yes, no, the answer is simply yes. There is nothing, it is that. And then there's another one, this is regarding home death. If death occurred at home, who is responsible for the contamination of the death? Handun? PHI?
What? Contamination?
Decontamination. Is it?
If this is regarding home death. If death occurred at home, who is responsible for confirmation of death?
That is
some
not
doctor
clear.
Has to confirm that he has died.
Now it is Grama Sevaka is also allowed with the allowed now new circular. Grama Sevaka is also allowed for the ones who had known causes of death, and if the MOH confirms that there is no possibility of COVID-19 from this area or this home, if MOH confirms. Otherwise, if it is not, we need to go for PCR and everything.
Right. So because it's this, that confirmation has to be, like, as you said, the declaration part, it has to be either medical person or a civil servant, right? So according to the inquest procedure, they are also can. Please explain how to handle home death. Can a GP can give a cause of death and coroner can take it as a COD?
Yes.
Handun?
Now they are
Same,
asking
little
regarding
bit
the
similar.
general thing. This the COVID deaths are specific. Now in general, other home deaths, sometimes the people or any other known person may come to you if you have treated the patient and you have to go and see. You can go. Some doctors are afraid of going to the home site and they will ask directly take the body to the hospital. That is unnecessary. So you can go to the home place, you visit the home place, you just observe the surrounding, and you can confirm the death. You are a doctor, you can confirm death. But if you don't know the real cause of death, you can give probable cause of death and order an inquest. That is only. But anyway, you cannot release the body. You cannot ask. They can do the funeral function after giving the cause of death. The coroner or the Gramanidari has to proceed with the inquest and come to that decision. Just you can confirm the death and if you can give the probable cause of death, you can issue. Even anytime you can issue probable cause of death, that will be very, very easy for the
Whole system.
yeah. And don't give false, you may think that this is my relative or this is my friend. In that case, I will give something cause of death and you want to help them to giving some cause of death. You don't do like that. You should have treated the patient. That may be a relative, but if it is a relative, it is better to ask another doctor to attend to that. Don't give the causes of death in relatives. You may be in trouble.
Yeah, because then it
is
will come a conflict of interest also. Other allegations can come for you. There's another question. Is there any probability to spread COVID-19 from dead body? If it is possible, even the normal cause of death in the mortuary, there is a possibility to spread virus to a not infected person, and patient can be COVID positive patient.
First we have to say that live patients are more effective rather than these dead bodies.
People, because dead people don't cough.
They are not coughing, they are not sneezing, they are not spitting, just they are silent. But if you go to the dead body and if you are not taking precautions, that may be contaminated with your hands. But in some cases, if there are limited space and with AC in the mortuary, that may be circulating the air also with the fans and waves of the air. So in that case, that may go into the nasopharyngeal tract even. The major contamination system is contact, touching, and sometimes fluid materials you may touch, that may be splash. In that case, you can get contaminated.
Right. Madam, could you please explain again how to fill WHO form in case of a cardiac arrest? Handun.
WHO system.
Yeah. Cardiac arrest. Okay, cardiac arrest is due to what?
Yeah. Now cardiac arrest is the immediate, what you have seen, that is the mechanism. No? So mechanisms, modes of death, mechanisms should not be inserted in cause of death according to the WHO system. But if you put that cardiac arrest, you can immediately, you have to find what caused the cardiac arrest. Sometimes even maybe a blow on the chest, or maybe some other disease condition. So that should be the 1B. Sometimes after 1B, you cannot finish in that 1B. You have to find that the cause for 1B. The final disease condition, the underlying cause disease condition, definitely not the mode or mechanism of death should not be the underlying cause. Okay.
Right. Then there's another question. If medical officer go and confirm a death occurred at home, should he or she give written document of death confirmation? If so, what the document we use? As I stated, ideally speaking, if you can give it in B15, ne the Handun? The home deaths.
The home deaths, we are not going to fill the form.
Yeah.
Just
Even
your personal
letterhead is more than enough.
Yeah, that is enough. You can write the cause of death.
Cause of death and that you have certified the death, that you have checked this, and you found that this person and you have treated the person and all that information and the probable cause of death. Then use your signature and seal, no?
Your signature and designation should be included. Only that. That is valid document.
That's a valid.
No need of the written these printed documents from hospital. You can't take these things outside. No?
Yeah.
Right.
I think we have finished the questions and we have gone over the time also. Anybody wants to make a clarification or any query further?
Yeah, they can personally call us.
Yes. Handun, can you give your phone number?
Yeah, note 71 41 999 51.
Yes.
Note 71 41 999 51.
Yes, so that is Dr. Handun Wijewardene, and as for me, not 71.
They can easily come to the
and Indira.
Not 71 961. Not 714 961 237.
Yeah. Okay. I hope that I think we have tried our best
Thank you very
to
much,
answer the questions. I think we can go for conclusions, right?